Auzubillahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Sarah Sayed. I am a psychologist and the director of clinical training at Khalil Center here in our Chicago office. Jazakallah khair for listening in today and joining us on this brief topic. I'm going to be discussing depression and managing the symptoms of depression and self-isolation during the current pandemic crisis. Depression is something that is not going to be going away necessarily or by itself getting better without active management. It's normal for everyone to feel down sometimes. Currently, even people who don't have a diagnosis of depression may feel overwhelmed, may feel fear and uncertainty, anxiety about what's going on. And that's completely normal. Adults, teenagers, children, elderly people, there isn't anyone who isn't in some way affected by the current global crisis. The difference between feeling down and having depression is clinical. And what I mean by that is having depression means you meet a certain set of symptoms for a certain period of time. It is very important for anyone who has a diagnosis or a history of depression to be very cognizant and manage those symptoms right now. Naturally, people with depression go towards wanting to be alone, sometimes don't enjoy the company of others, have a hard time feeling pleasure in things that they used to enjoy, even their hobbies. Food doesn't taste as good sometimes. Things they used to look forward to start feeling overwhelming and unnecessary. People with depression sometimes excessively sleep and sleep longer than 8 hours. And unfortunately, the way the body works is when you sleep more than 8 hours, you get up feeling even more tired and more lethargic. Naturally, depression also depletes our energy sources. So right now, the government is saying people should be staying at home. We know that the best way of managing the pandemic is social isolation. Unfortunately, that's not healthy for somebody with depression. So someone who has those symptoms really needs to make sure that they're following a structured routine every day. That means things like getting up the same time every day. It doesn't need to be as early as you normally would have for work or school. So maybe not 7 a.m., but maybe 8 a.m. or 9 a.m., taking a shower every day, even if you don't feel like it, changing your clothes every day. There's no reason to necessarily get dressed up if you're at home, but staying in the same clothes you slept in contributes to that feeling of this day has no structure, and people tend to feel down from doing things like that. So making a point, even if you're wearing a different set of pajamas, but not the ones you slept in. Also, things like having a routine to follow gives order to our day, helps provide some structure for us to follow that makes it feel like you have some control. A big part of the anxiety about the situation is a lot of this is out of our control. The most we can do is stock up on groceries, make sure that we wash our hands and sanitize properly, hopefully not buy too much toilet paper. Luckily, we know better ways of cleaning ourselves. But at the same time, every human being has to feel some level of control. Knowing that you have something to do at 12 o'clock, 2 o'clock, 3 o'clock gives us some of that feeling. And this includes things like exercising regularly. For anyone who has depression, you've often been told, I hope, that regular exercise helps improve and manage symptoms. Exercise releases endorphins. Gyms are closed right now, but that doesn't mean we can't work out. Most workout facilities are currently offering free online classes. You can check your normal gym, but you can also, this is a great time to experiment and try a different program. There's also a lot of videos and exercises that we can follow even before all this started. And the other thing is it's really important to try to get out every day. There is no prohibition on going in your backyard or taking a walk around your neighborhood. The prohibition is on getting close to someone else. So maintain the social distance that's required, 3 to 6 feet apart from the next person, but take a run in your neighborhood, take a brisk walk, do something physical, ride a bike, and then come back home. And again, just make sure you wash your hands and sanitize properly. Regular exercise releases endorphins. Endorphins help us manage our mood. Endorphins help us feel energized, and they help you sleep better, all of which is important for managing depression. If you're on medication, this is not a time to ration. There is no need and no notice from anyone that there's going to be any shortage of medication. All pharmacies will still be operating. Make sure you take your medication on time every day. If you are in the process of increasing or lowering your dose, please make sure you're in touch with your doctor about that. Physicians can still be accessed even if you're not going in for an appointment. Almost all physician offices have either an email or a web portal that they use to talk to their patients. Please find out what your doctor has in place, or make sure that you're aware of how to access it so you can ask those questions. Your pharmacist, wherever you get your medication, could possibly also be a good backup source if you need to ask general questions about the medication. But this is not a time to be afraid to take it. Take your medicine every day. And most medication is not on an as-needed basis when it comes to depression. That means you can't only take it when you're not feeling well. You have to take it every single day. The other important piece right now that we need to discuss is the isolation. As I mentioned earlier, depression naturally makes people have a craving to isolate, not want to be around others, not want to take the time to participate. It definitely takes a level of energy to be able to be around others. And even extroverts who feel depression aren't good at that, and they don't want to do that. It can be draining, it can be exhausting, it can feel like an unnecessary effort. Right now, you don't have to want to. You don't have to enjoy it. But this is something that needs to be a part of everyone's routine, especially those who have a diagnosis of depression. So what does that mean? Inshallah, if there's someone else in your home with you, if you live with a family, roommates, whoever you live with, make sure you take some time during the day to spend with them. You don't need to spend all day every day with anyone, and we'll get to that because that might not always be a good idea either. But maybe share meals together, or check in, or watch a show or TV at the end of the day, maybe pray salah together in your home. Those kind of activities keep people from feeling unconnected. The other thing, of course, is missing the people you can't see. Many of us right now, it's just not safe to visit family, to visit your parents or grandparents, to visit somebody who has an immunocompromised person in their home. I haven't seen my parents in 2 weeks and I'm already feeling it. So that's really hard. FaceTiming or video chatting is one way that we can try to work on that. Make it a routine, make it part of the schedule. Every other day from 7 to 7:15, I'm gonna FaceTime my parents and let my son talk to them and feel like I know what's going on with them. Sometimes we can do things like, use Amazon or different websites to send groceries or send something to cheer them up and feel like we're still connected. Even if you find out, your parents have run out of light bulbs. Sending light bulbs helps you feel like you're still doing something for them, even though you can't go and visit them, take care of them the way you'd like to. And of course, when we want to feel connected to people, making dua for them is always a wonderful way. Allah subhanahu wa ta'ala hears that, and remember the angels say Ameen for your dua for you as well. Besides that, things like keeping up with whatever your regular assignments are, whether that's school, work, household chores, personal goals, something that you need to get done. Every day it's important to have some sort of goal. It doesn't need to be a huge goal, whatever is important to you. You might pick one day to get a household chore done and the next day to get some work done, another day to get some reading done. It doesn't have to be the same thing every day. You get to decide what you want to do, but it's important to have something that you can look forward to and know you're going to do it. It's important to make sure you get some sunshine, some fresh air every day. Like I said earlier, there's no prohibition on being outside. It's about being with other people. Sunshine and fresh air is also really important to help our mood. Being outside in nature naturally helps people feel relaxed, tends to help people feel a little bit better, even when things are not going well. Some things that we have to be mindful of course, if the weather is bad, and if you're in an urban area that doesn't really have outdoor space, this might be a bit harder to navigate. But for those of us who, alhamdulillah, have either a backyard, front yard, or even just sidewalks in the neighborhood, try to take advantage of times when there aren't too many people outside, middle of the day, early morning, whatever's comfortable for you, and spend some time outside every day. The people you have in your home, as I was saying earlier, sometimes, as much as we may love our spouse, our children, our family, being in front of each other all day long, every day, can become draining on us. So again, when we talk about having routine and structure, particularly if you're not someone who's ever worked from home before or who does that regularly, it's really good to set up separate spaces right now. What that means is, even if you're helping your kids homeschool right now, even if you and your spouse are both working from home, everyone should not be on the same dining table. Your home may not have an office space set up, but whatever corner there is or whatever rooms people have, assign different spaces to different family members, and as well as a space for the family to join communally. Family being whoever you live with, whether it's your spouse and kids, your parents, your roommates, your friends, but just make sure everyone has an opportunity to have their own space. When we're talking about long-term being confined in the same space, depression and depressive symptoms are not going to be helpful. So being on top of these things and try to manage these symptoms is very important. So just a quick recap: take a shower every day, even if you don't want to. Change your clothes every day, even if you don't want to. These are the kind of things that are going to help you feel like it's a fresh day. Have a list and a structure of what your plan is for that day. It's okay if you don't meet every item on that list, but it gives you something to look forward to and try to keep up with. If you are on medication, make sure you are compliant with it and make sure you know how to contact your physician if you have any questions or any issues with it. Remember, pharmacies are open. Many pharmacies have drive-thrus. Several pharmacies are also offering delivery and drop-off options. So if you're not feeling well or you have an immunocompromised person at home, that is also an option for you. And it's normal to feel overwhelmed by this situation. It's normal to feel even more isolated than you might on average feel. Do your best to keep up with friends and relatives, even if you don't feel like it. Whether it's a video message, phone call, even a text or email. Getting a response, knowing how people are doing, letting them know how you are doing is very important to being able to manage your symptoms. Inshallah, I hope this was helpful, and thank you again for joining us today. Inshallah, I wish you and your family good health and safety during this time. May Allah make this easy for all of us, and inshallah, may we all be done with this quickly and get back to our regular routine. Wa alaikum assalam.